my right hand side to come on this side so that they can see it clearly. Because when I was sitting here, I could not see anything, and that's how I moved on this side. Wait. But still, I'll take you through whatever I have to say. The topic given is framing a research question. And as a medical practitioner, I don't think framing a question is difficult, because we are taught in second MBBS when we start the clinic how to elicit a history, and history starts with asking the questions. So, should not be a difficult. So, if it is not difficult, why you are talking? So, research, and I'll take you through how it can be made easy or difficult. So, what is the research? Most of us have a problem here rather than at a question. And I have put 3 different varieties to answer the question, is to see what everybody else has seen. Like Sangwan said, everybody has seen BKC, but think what nobody else has thought, and that's how you get a research question. And he nicely showed it through various examples of his own. Okay. The next is research is the term applied to any form of systematic and organized investigation to establish facts or collect information, and usually related to the problem that needs to be solved. And here what you say, doctor, comes. You have collected information on 200 subjects. It is related to a problem which needs to be solved, because everybody does not know that there is therapeutic intervention and there is a diagnosis, and you can do that. And still third one is to steal ideas from one person is plagiarism, which is bad, particularly when you want to publish. But to steal ideas from many is research. You steal ideas from multiple sources, comprehend them and put it together, and it becomes a research. And like Virendra said, this is also from Albert Einstein. The important thing is not to stop questioning. And that's what we are told in first MBBS. You can't question your anatomy professor, you can't question your physiology professor. You have to believe whatever they say. But we need to forget that. Curiosity has its own reason for existing, and we need to nurture that. And if you start thinking like in this cartoon, that I know everything, and there are only 3 types of people who knows everything. First is a politician, second is a priest, and third is a private practitioner. These are the people who knows everything. They have answer for everything. And this is the reason you can't do research, because you have an answer for everything. If you have an answer for everything, you don't have a question. And if you don't have a question, you can't do research. So, put it simply, if I put a question mark and use the question mark, will it become a research question? It looks very simple, because research begins with a question. But when you ask people in general, like in this group, everybody by and large says, I know what the general area is, but I'm not sure of my research question. Like he said, I have 200 patients data, but I don't know. I know that how to treat it, what to do, but I don't know the question. And since I don't know the question, I can't answer the question. So framing the research question can be actually hardest part of the research, and if you can do that, it's wonderful. And then there's a quote, do not give up, the beginning is always the hardest, and framing a question is the beginning. So why the research questions are important? First, it guides your research. It will tell you what you are supposed to do and what you will be doing. It helps you in planning your research. At what stage, what will you do? At what stage you will stop? How far you will go? It will set your boundaries. And it will improve chance of success, because it is for a success you are doing. It is not to satisfy your ego. And ego gets boosted when you have a success. So it improves your chance of success. And good question is a good beginning, and good beginning is half one. So how do you conceive a question? As Sangwan has rightly said, think about the questions you face. It is your patients, it is your students, it is your colleague, it is your peers. They will constantly bombard you with questions, and he rightly said that you need to change your students so that you get different kinds of questions and you try to address them. You can start from your personal experiences that, okay, I treated in a particular way and I got a particular type of results. Can I improve on that? Is it as good as others have? You can make it observations. Like he said, I'm pointing it to you, but he said, I've made observations of 200 cases, looks like this, treated with a therapeutic trial, doing well. That's an observation, and you can start from there. Most important is, have a skeptical attitude towards standard practice. Whatever is standard does not remain standard for a long. Somebody will always challenge it, and why can't you challenge it? Like Dr. Santam said, don't go beyond 10 years for evidence 1, level 1 evidence, because standard keeps changing. Level 1 evidence is standard, but it keeps changing. So you should be, why you should not change? So become skeptical. And then start looking at new technologies, new drugs which comes into it with a skeptical mind. And skepticism can be 2 types. One is you can negate it, another you can augment it. So you can say that, okay, this has been told by me that, okay, this machine can do this much. Does it really good? I think it is not good. That's also skepticism. The other type of skepticism, why can't it do better than this? What else it can do? That is also skepticism. When you try to consider a question, the most important thing is you need to be alert. And how you can be alert? By reading the literature. You can remain updated so that your antenna will pick up whatever stations are available. You attend the conference for the same reason, and then you will meet the people, you will be networking, and you will get some face-to-face interaction rather than reading, which is little dull and dumb and little late. Conferences will give you little upbeat, little fresh, and sometimes it will tell you something before it is presented also. Because when you talk to the friends in the same area, he says, yes, I have documented this, but I have not presented, not published, and that will happen only in the conferences. And then be alert towards new technologies. As we age, typically there is a tendency that, okay, this is not for me, it's for somebody else. Don't neglect that and be alert and try to know as much as you can about all the technologies around you, whether it's a computer not related to ophthalmology, because ultimately it will come in your door. Mobile with all the gadgets. So try to be techno-savvy and then try to be an expert. And you can't be expert in all the areas, but wherever you try to focus, like someone said, okay, I focus on an ocular surface disorder with cell therapy, and then he became a master over time. He mastered the literature, he mastered the subject, and he created the literature. How do you improve the quality of questions? Once you have asked, try to answer it yourself without going into too much of a detail. And once you do that, the answer may be of no use to anyone. You may find that, okay, I know this can be a potential answer, but if it will have a utility, like I said, decreasing the phaco incision size by 0.2 millimeter, reducing the astigmatism by 0.25. Is it useful to anybody? If answer is no, that's not a good question. Or you may feel that I will not be able to generate an answer, or I don't know what the answer could be, then also it's not a good answer question. So another way of improving the quality of question is bounce the questions to the expert. Whomsoever you feel expert in that area, bounce a question. He will come back with either suggestions or a small simplified questions. Go to the mentors, and it's always good to have a mentors around you, and colleagues are always there, and they are the best critics because they are not afraid of you. They will tell you up front, oh, whatever you say, I don't agree with you. And when you reach that level, try to reframe it, narrow the scope by clarifying and redefining it, and this is an iterative process. You have to constantly churn it like this. I mean, this is from a book. Research questions, reading, ideas, come back to research questions, ideas, methods, do something, and constantly keep doing it, then you will go forward, forward, forward in the same direction, like Sangwan did. Now, what constitutes a good question? The good question has to be feasible, interesting, novel, ethical, and relevant. And when you meet all these 5, there's one more test, so what? Even if the question is feasible, I can get the answer. It becomes interesting, novel, ethical, relevant to the story. But so what? Does it do anything extra? Does it provide anything extra? And if you fail this test, probably you should not try to attempt that question. When it comes to the feasibility, you can look into number of subjects that I can generate and number of subjects are needed to answer that questions. Do I have a technical expertise and resources? Like I said, I don't have a resources like PCR. What can you do if you don't have a PCR? It's not feasible. I can't have a PCR from somebody else. My patient can't spend money. Look at that. Affordable. Whatever I'm going to do, is it going to be affordable in terms of will I be able to generate funds or will I be able to meet the expenses? And then scope. What is the scope of the question? And then based on whatever you get here, you can narrow the question strategies for sample size reductions, research training, mentors, appropriate follow-up. Is the question interesting? Is it interesting to me first? If it is interesting to me, then only it will move forward. If it is interesting to me and I am passionate about it, then I should look into is it interesting to others. And the others constitutes mainly for the clinicians, the patients, subordinates who are going to help me in the conduct of that research, my colleagues who are going to overall oversee. They may not tell me upfront, but after some time they may say that, okay, this is not a good idea, you are wasting your time. And then to make it more, you can consult the mentor and change the question to meet this requirement. Novel has a different meaning for a different people. So when it is a novel, does it provide novel finding? Because this is important for all the journals. The first question, what is a new finding in dress? It can be entirely different. And entirely different comes once in a lifetime. It rarely comes. Like law of gravity and law of relativity were entirely different. Nothing existed. But it happened only 2 times. One by Newton, another by Einstein. But typically, most of the research is into
people they're saying that apples are falling forever.
Yeah.
But there's only Newton could think about it.
Yeah.
And why they are falling.
No, what I'm saying is those kind of questions are answered rarely.
By people who have
So
that kind of.
So I'm taking you through. So to make the life simpler, if you can attempt that and answer that, it's wonderful. But it's a rarity. If you look at the literature, this kind of questions are rarely asked in the literature. If you scan 1,000 articles in any particular journal, it will be difficult to have a single article addressing this issue. But by and large, it is an incremental research. Somebody has done something, somebody takes it forward, and then somebody takes it more forward. So it's incremental. I'm not saying no to this. But what I'm saying is putting a word of caution. In the beginning, don't go for this, try to do this. Challenge the old dogma. Important to review the literature and become an expert, because you need to know what is the dogma is, then only you can challenge it. And then when you are trying to challenge it, you can consult people around you. Easier way is extend the previous finding to a new settings or a population, and when you do it, next level will come. How interesting that will be. Say Sangwan did in LV Prasad, can I do it in M&J in Ahmedabad? And does it, a novel? It's novel for me, it's novel for the institute, but it's novel for the general public in question. Or you have some findings which are unique in certain populations, you change it to the new populations. Confirm or refute previous finding. This also becomes a novel when that finding is not well documented. If there are 3 or 4 publications on a particular area, you can be 5th one, 6th one, and still it will be considered novel by the reviewers. Ethical, does the study pose unacceptable physical risk, and does it pose a risk to the privacy? And under such circumstances, if required, you can consult the institutional review board and take their opinion. To me, this is not always necessary and possible. Is it relevant to advance scientific knowledge, to influence clinical and health policy, and to guide future research? So, how do we go about it? How do we put questions, Mike? Widely used questions when you review the literature is how and what. Why is difficult to answer question, but not that you can't answer question that. When and where are rarely used. In scientific literature, these questions are rarely asked. Try for an incremental advancement rather than trying to climb a mountain in one day. Break questions into smaller, narrower questions till it becomes answerable. Because what was not feasible will become feasible. And you can do that.